Motor neuron diseases. The motor neuron diseases, referred to collectively as MND, are a group of neurological disorders that selectively affect motor neurons. MND includes the following clinical types: both upper and lower motor neuron damage, which results in amyotrophic lateral sclerosis, known as ALS. The diseases resulting from lower motor neuron damage include progressive spinal muscular atrophy and progressive bulbar palsy. ALS is the most typical and common type. All over the world, ALS is considered to be synonymous with MND. It is also called Lou Gehrig's disease in the USA. Amyotrophic lateral sclerosis is characterized by a gradual degeneration and death of motor neurons. ALS is an invariably fatal neurological disease that attacks the nerve cells, neurons, responsible for controlling voluntary muscles, such as those in the arms, legs, and face. Motor neuron diseases, fasciculations. Fasciculations originate at the very tips of the nerves, called axons, as they come close to being in contact with the muscle. The tips of the axons are thought to be overly sensitive to depolarizing, in other words, electrical firing, which is what triggers a muscle to contract. When a nerve fires zillions of times a day upon request, an electrical impulse starts in the nerve, moves out toward the muscle, triggers the release of a chemical, acetylcholine, that swims across the gap between the nerve axon and the muscle and binds to a receptor on the muscle, causing it to fire. The complicated process itself takes a small fraction of a second. If any of this happens involuntarily, then the muscle fiber contracts without your permission, and behold, a muscle twitch or fasciculation occurs, such as those in the arms, legs, and face. Motor neuron diseases, dysphagia. As swallowing is a complex process, there are many reasons why dysphagia can develop. Some causes of dysphagia are explained below. Neurological causes. The word neurological refers to the nervous system. This is made up of the brain, nerves, and spinal cord. Damage to the nervous system can interfere with the nerves responsible for starting and controlling swallowing. This can lead to dysphagia. Some neurological causes of dysphagia include a stroke, neurological conditions that cause damage to the brain and nervous system over time, including Parkinson's disease, multiple sclerosis, dementia, and motor neuron disease. It can also be caused by brain tumors or myasthenia gravis, a rare condition that causes your muscles to become weak. Fasciculation occurs, such as those in the arms, legs, and face. Motor neuron diseases, dysarthria. Dysarthria is difficulty speaking caused by problems with the muscles used in speech. A child or adult with dysarthria may be difficult to understand. Their speech may be slurred, imprecise, or quiet. In some cases, the individual will only be able to produce short phrases, single words, or no useful speech at all. Acquired dysarthria in adults. Dysarthria that occurs later in life usually results from a condition such as a stroke, a head injury, a brain tumor, a progressive condition such as Parkinson's disease or motor neuron disease. Speech can be affected in a number of ways by the above conditions. For example, speech can become quieter or slurred, the voice can become hoarse or strained, patients may have altered speech rhythm or have hesitations in their speech. Dysarthria can affect the person's ability to engage in everyday activities and work. They may also drool and have swallowing problems, referred to dysphagia. Motor neuron diseases, spasticity. Spasticity is a condition in which there is an abnormal increase in muscle tone or stiffness of muscle, which might interfere with movement, speech, or be associated with discomfort or pain. Spasticity is usually caused by damage to nerve pathways within the brain or spinal cord that control muscle movement. Cramps, limb onset disease. In about 2/3 of people with motor neuron disease, the first symptoms occur in the arm or leg. This is sometimes called limb onset disease. These symptoms include a weakened grip, which can cause difficulties picking up or holding objects, weakness at the shoulder, making lifting the arm above the head difficult, and tripping up over a foot because of weakness at the ankle or hip. These symptoms are usually painless and may be accompanied by widespread twitching of the muscles, fasciculations, or muscle cramps. Motor neuron diseases. Cachexia. Cachexia is respiratory failure. The primary cause of death in ALS sufferers is respiratory failure. Motor neuron diseases. Mental issues. Amyotrophic lateral sclerosis sometimes comes hand in hand with dementia. An estimated 15 to 41% of ALS patients have cognitive changes, depending on how these changes are tested for. The most common type of dementia associated with ALS is a frontotemporal dementia with personality changes and less impulse control. There is little consensus on how these dementias may be best managed, but there is certainly no easy cure. Sometimes an apparent dementia may actually be the result of inadequate sleep or depression, and so it is important to make sure these factors are being treated. Otherwise, the management of these dementias relies on working with a team that may include a social worker, neurologist, and psychiatrist to manage the patient's behavior. As always, planning ahead is key. Mood. With all the negative changes that come with the diagnosis of ALS, some depression and anxiety has to be expected. Surprisingly, these feelings tend to be less common among those with ALS than other diseases, such as epilepsy. If these feelings are present, they are best managed with a combination of counseling, therapy, and medications, such as antidepressants. ALS can cause other changes that mimic more common depression and anxiety. For example, what may feel like depression may actually be fatigue due to muscular effort and poor sleep. Furthermore, due to the neurological changes of ALS, patients may suffer from a pseudobulbar effect, also known as involuntary emotional expression disorder, or IEED. This means that their emotions are unstable, and they may find themselves laughing or crying in inappropriate situations. A combination of dextromethorphan and quinidine has been shown to be effective in helping this symptom.